Hello, my name is Dr. Komloshi. I'm a GP from King's North Medical Practice. In this series, we are looking into common health conditions that might be treated at home without the need to call the doctors. Diarrhea, vomiting, loose or watery stools, caused by a tummy bug or food poisoning, also called gastroenteritis in medical terms. It's an infection of the guts caused by virus or bacteria. Usually vomiting starts first, then the diarrhea comes, but you might have one or the other only. Most times the infection settles without medication, regardless if it's a bug or food poisoning. Antibiotics are not normally needed. In average, vomiting lasts from 1 to 3 days, whilst the diarrhea can last from 3 to 7 days. You will feel rough and unwell for the first few days with stomach cramps, reduced appetite, and you might have temperature. Take rest. Call the doctor if you notice blood mixed with your stools. This could be a sign of a more violent bug, and you might need medical treatment, especially if you are returning from tropical areas. If you vomit violently, you might see streaks or specks of blood in your vomit or in the mucus that you bring up. This is normally harmless. If there is more than that of blood, seek medical attention. Call the doctors if you don't pass urine at least twice in 24 hours, or less than 2 wet nappies in babies, as it could be dehydration. Call the doctor if your stomach pains are severe and continuous, lasting for longer than 4 hours without breaks. Call the doctor if you have high temperature above 38.5 for longer than 3 days. It's always a good idea to have a good working thermometer at home. Call the doctors if the diarrhea lasts for longer than 2 weeks and not improving, as you might need stool samples. Call the doctor if you are frail, elderly, or if you are in ill health with kidney, heart or endocrine disease, or you are on certain medication that might need to be stopped or the dose increased during an acute illness. Call the doctor if you have severe diarrhea with or after an antibiotic course. Antibiotics can give you a little bit of stomach cramps and loose stools. This is unfortunately a side effect. But if you have severe watery diarrhea several times a day, call the doctors, as it could be a sign of a C. diff infection that might need hospital treatment. You can do things to get better whilst you're ill. Continue sipping water between vomiting episodes, even if you feel that it all comes back. Believe me, some will get absorbed. Once you can tolerate water, drink pressed 100% apple juice, diluted half and half with water, to replace the minerals and the fluids that you are losing. You can choose to drink oral rehydration fluids like Diarrhoea, but the taste might put you off. Apple juice is just as good. Avoid squash that contains artificial sweeteners that might make your diarrhea worse. And you need the sugars this time to keep you going. Continue breastfeeding your baby or offer them normal formula milk as demand when they have diarrhea. If your child who's over 6 months of age refuses to drink and you are worried about the risk of dehydration, you can administer water or other fluids via a small syringe that comes with Calpol or other medication directly to the child's mouth. Give small amounts, 5 to 10 ml every 10 minutes, and record it in a chart. It's called a fluid challenge, and nurses often use it in hospitals to try to avoid the need of IV drips. Only eat when you are hungry. Do not force yourself. Your appetite is gone as your guts are inflamed and they are not ready to digest food. Give them a break to recover. Not eating for a few days is not harmful for your body or your child's body. Just carry on drinking. When you are hungry again, eat small amounts of very bland food like white toast with jam, no butter, cooked rice, cooked potato, apples, bananas, clear vegetable or chicken soup. Avoid meat, dairy, fibers and fat, as they are very hard to digest. Beware that crisps and crackers are rich in fat. Avoid these until you are better. You can take paracetamol and buscopan if you need relief from pain and cramps. These medications do not cure or shorten the disease, but provide symptom control. Absorbents like Smecta might shorten the diarrhea duration by half to 1 day. These are available without prescription. The use of Imodium that contains loperamide is controversial. Several studies showed safety and efficacy, however we GPs still advise against them. Do wash your hands regularly, especially after toileting and before meals. You can find further advice on the NHS website. If you still have questions, please go to the website and submit an e-consultation with your questions and queries. We'll get back to you. Get better soon. Bye.